Yeah, so I'm Paul from Transition Services. Since agreeing to do this, I've actually changed my job title. I'm now a reviewing officer. I'm now a reviewing officer with the team. What I wanted to do was just give an overview of transitions, but give some additional information for those who may not be with our team as to how you can access services, and just give you an idea of what we do, really. And there is a couple of additional things that might be helpful as well. So transitions work with young people. I need to go back. I'm not very good with technology. We work with young people. Our criteria for support is now, it has changed recently. You need a diagnosis of severe learning disability, need for adult social care support once someone reaches 18, has an EHCP. We do take young people from CDS, and at the moment is at 17.5 years of age because of staffing. It's sort of changed, but there is, due to the changes in national policy, a review is currently being held to work out the pathway for 16 to 18-year-olds. So we're not taking direct referrals at the moment. However, I'll show you how people can access our services. Can I go on to the third, actually, because that is more relevant, and then go back. So if somebody isn't with transition, is wanting to look for support, if they haven't got any services at the moment, they can, if the young person is between 16 or under 18, in fact, they can ring SPOA, and presuming that this will be made available, this is the phone number for SPOA. They're a gateway team for people under 18. And if over 18 is Social Health and Social Care Connect, and those two teams will put someone onto the appropriate team for that young person, dependent on their needs. When someone starts with transition, we send them a welcome pack. The idea and purpose of my role is to actually start doing this with a lot of our young people, is review and start a core assessment at around 17.5 to 18 years old, preparing them for adult services. If services need to be commissioned, this would be based on assessed need. Funding then would be requested if they're under 19 from Children with Disability Services. But it has got to be on assessed need. Where over 19, if services need to be commissioned, it would be from the team based on their needs. So if they've got severe learning disability, it would be the learning disability panel. Otherwise, it would be the neighbourhood support team, in a small number of cases, mental health team. But as I say, it depends on their needs. I am doing some work at the moment with a couple of young people where they've got such complex needs that I'm seeking support from the LD panel. When someone reaches, if someone is with us before, it doesn't affect historic people. So if someone's within the team, they won't be taken out if they haven't got a severe learning disability. And at 19, funding is taken over by the appropriate adult panel. We would do a review and go to that panel. And at age 25, they would be long-term with the long-term team based on their needs. So again, whether learning disability, neighbourhood support, or mental health team. We hold annual reviews, and again, that's part of my role now, is to do the annual reviews. However, if there is a change of circumstances, someone should always come to a duty for the team supporting them, like if education's ending, as an example. With transitions, we support with the support between children's and adult services with that. If I do an assessment, as I say, any funding request would need to be meeting assessed need. For example, accessing services without a parent or family member being with them, that to sort of break that reliance on that person to start that moving towards services in the longer term, starting to develop confidence and independence in the community. And that might be through attending community events or activities or going on public transport. So that would be discussed at the review, starting to develop social skills in community settings, getting used to being with other people away from college that they don't know, giving them the opportunity to build friendships and reduce isolations. We might look at holiday support when they're at college. Some of our support is only from 19, but we can look at that at the time, start to build confidence, start to build the young person's confidence in adult social care, because they might be really anxious about it. We can do it in a way that hopefully can help them access it without causing problems. And to say, it's just going through all the different areas. As say, if you're wanting to explore respite provision, starting to look at how that might, some people might just take to it like to a duck to water. Some people will be really anxious, looking at whether I'll come onto our own services, but with our own services, respites over 3 or 4 night stays. And some people won't be able to cope with that because of their anxieties about being away from home. So it's looking at how they might be able to access respite and helping to move, and that can help to move towards independence away from home over a period of time. Parents struggle, where parents are struggling to cope through their own health needs and coping with the high levels of caring responsibilities. That is another care need that can be addressed, and we would look to do carers as well, in particular at 19. And but you've been tasked with one beforehand, and developing a plan to start with the service as a stepping stone to long-term provision, and that might be like starting respite care as a stepping stone towards moving into independent living. We look at our own services. With under 19s, we've got PBS support, so we've got the positive behaviour support team who can do 3 sessions without having to go to panel under certain circumstances, but we can seek longer interventions, and we've got an outreach service with the under 19s, and with over 19s we've got day services such as Linden Court in Eastbourne, St Nicholas in Lewis, and Beeching in Bexhill and Hastings, respite services, employment-based activities with our Step Up to Work team, and health-based support by being able to access LD team. And we obviously go to external services, including looking at direct payments and private and charitable organisations. And I'll come on to Brain in Hand at the end. Sometimes with some of the decisions that need to be made, in particular when looking at moving to alternative accommodation, we would need to complete a mental capacity assessment, and where there is, because they're adults, where there isn't capacity, a best interest decision will be made, but that's done with the full involvement of the family. And quite often, if everyone's in agreement, a meeting's not even needed. However, if somebody is interested in looking at LPL deputyship, we would quite often put them onto a maze because they're independent to get the advice that you need. This is an area that I'm involved with. I'm the armed services champion within our team. If somebody is a veteran, they might be have been admin within a regiment, or they've been in the services, and for at least one day there is additional support available to them. And I'm in the process of providing a document which I'll share with you, Marie, that can offer support on quite a number of areas around housing, health. You can get easier access to health. They provide cards you can give to your GPs to hopefully get access. And that's not just for you as parents, but for people who are dependent upon you, who live with you. So the young people we're working with. And I've recently managed to get support for mental health issues for a number of parents, where they've been quoted 2 years, up to 2 years, waiting on a waiting list, and they've managed to get some support within a few weeks. They can get legal support, there's support for families, there's peer support, there are breakfast clubs and peer groups within all areas within the county. So we can put you onto them. Benefit and debt advice, helping with alcohol, drugs issues, employment issues, education, training, housing. If someone's at risk of losing their housing, they can help. Financial support. I've just recently put in a referral for someone that needed building work because they couldn't access additional funds through the mortgage. The father was in a regiment previously, and hopefully they're getting support to do this because there's some severe damp, and they're hopefully going to get the work needed paid for through the regiment. But I'm going to be providing, as I say, that document. So I will send that on, and that can be passed to you if you're interested. And I was going to mention about Brain in Hand. This is something that our county have just subscribed to. We've bought in 40 places, I believe, with Brain in Hand. I don't know if you've heard of it. And it is supported, it's for the more able young person that we work with. And it's NST and LD services are both involved, I believe, as well. And it's goal setting, basically, with support from people within the Brain in Hand team. And I've just managed to get my hands on the paperwork, and I'll pass that over to you again, Marie, as well. So that's it, really.
Lovely, thank you, Paul. So if you're able to stop sharing, that would be fabulous.
Sorry, it's quite dry, but as I say, if you've got any questions, I'm happy to.
Lovely, thank you, Paul. So as I mentioned earlier, if there's any questions, you're welcome to pop them in the chat or just note them down, and then we'll go through all questions at the end when we've stopped our recording. Thanks so much, Paul. So our next speakers, and I'm going to try and get your job titles correct because they're quite long. So we've got Angie and Lee. So Angie Godden is the Roald Dahl Transition Nurse Specialist in Paediatric Neurodisability with the East Sussex Healthcare NHS Trust. And Lee is the Roald Dahl Young People Transition Specialist, also with the NHS Trust. Did I get that right, Angie?
You did, yeah. And Lee's just rejoining us because he's just had to reboot his computer.
Oh, okay, lovely. Okay, I'll leave it with you then, Angie. Thank you so much.
Right. Well, Lee was doing tech stuff, so this is great that I've left my own devices. But let's see how we get on. Right. Can you see my screen?
Yes.
Perfect. Oh, it works. This is all good. I'm all very new to Zoom. It's not something that I'm great with, but there we go. So we'll put this on the side here. Hopefully. There we go. So that's off. So I'll start and Lee will join us in a sec when his computer plays game. So in our team, there's 3 of us in our team. We've got Susie Marsden, who's our lead. And she's been in post about maybe 3.5 years, and she strategically supports the transition within East Sussex Healthcare, so supporting those paediatric services going over to adults. You've got me, so I am the neurodisability nurse specialist for transition. I'm the first Roald Dahl nurse in East Sussex. And I'll talk about that in a little while because I love talking about Roald Dahl. And my specific caseload is the neurodisability caseload. And then we've got Lee, who joined us last year. and he basically looks after anybody that doesn't have a neurodisability. So if they don't meet my criteria, then they go over to me. And then what we've done is we've adopted Lee as a Roald Dahl nurse, because you get benefits as families and support around having a Roald Dahl nurse on your caseload or being on one of our caseloads. We're members of the Birds National Transition Nursing Network as well. They've been really good at pioneering transition across the country. I'm going to crack on till Lee gets here, all right? So, but some just stats from long-term condition, and 1 in 5 of those are aged 10 to 24. So you can see that's quite a lot. And 16% of these 16 to 24-year-olds are reported as having mental health conditions. So, you know, we are very mindful of these stats when we're doing things. So what do we mean by transition? So there's lots. So this is a slide that we did with staff and with parents. There's just so many words that just sum up transition, and it happens throughout our lives, and throughout our young people and children's lives. So, you know, moving on, and it's overwhelming. There's just so many words that spring to mind when you say transition. So we call transition a purposeful and planned process of supporting young people and their families and carers to move on from paediatric to adult services. That's the quote from the RCN, because we're both nurses by background. And the NICE guideline covers all young people aged up to 25 using children's health and social care services that are due to make a transition to adult services. This includes young people with mental health problems, disabilities, life limiting, complex needs and long term. So it's, you know, where we're at. A bit of a background. I'm going to talk about, I forgot to tell you where we've come from actually. So my background is that prior to taking this role on 2 years ago, I spent 22 years working up at Chaley Clinical Services in a variety of different services up there, and have a wealth of knowledge and experience around working with children, young people, families, complex needs. And Lee, prior to him starting with us last year, he's come from continuing healthcare, and he was the transitions lead within continuing healthcare, and he's a learning disability nurse by background, and I'm a paediatrician. So a bit of background around transition. So it started way back in 2018 with a lady called Angela Horsley, who took the need up to NHS England with the whole idea of improving experiences for young people and families that are moving over to adults, to achieve those best possible long-term outcomes for young people with long-term conditions, provide an uninterrupted and coordinated approach to healthcare across the transition pathway, and have real organisational boundaries. She really wants to drive change within organisational cultures, and to really embrace and embed developmentally appropriate care, which is something we talk about quite a lot with age appropriate care. Just to know that there is an understanding, and that we as the NHS and as professionals are meeting those unique needs of our young people. It's not just a number, is what we say quite often. And to affect change and establish that best practice transition pathways, make sure that they are safe, sustainable and cost effective. And there is a lot of national work going on around transition as well at the moment. So we joined this collaborative from East Sussex Healthcare in wave 2. I wasn't around in wave 2. Yeah, so that's where we're at. As parents, this isn't going to surprise you. This is some background around what people say about transition. You know, how do you feel? It's like a cliff edge. We're overwhelmed. We just don't want more meetings. You know, I'm sure there's nothing on there that isn't a shocker to anybody. And it's, you know, just hard, we know that. So what's our role over at East Sussex Healthcare? So we're based over at Eastbourne DGH, and we have I work at Eastbourne DGH, and Lee covers over at the Conquest.
And I'm back as well.
Oh,
Hello.
and he's
I'm really
back.
sorry, my computer just completely went on me. I'm really sorry, I've just rejoined. Hello everyone.
He's back from outer space, so that's good. So if I do this slide, Lee, I don't know where we're at with slides, but yeah, if you can see what number slide this is, then that's great. I'll crack on till you take over. So at ESH, we support young people and their families. From the age of 13 is where we start coming on board. We appreciate that's really early, but there's a lot of work and a lot of research around the fact that if we start transition early, it has so many more benefits because it becomes a gradual process. And that's a key element of our roles working in transition, so that we get to know that young person and the family, and we are there. We aim to stay with you until your young person is settled into adult services, and that can be up to the age of 25 if it's needed. Obviously, once you're settled, then we're happy to say, brilliant, that's fine, but some people will need us till they're 25.
Angie, so because I missed the start of there, did you cover the specialist pathways and what they are and who does what?
No, I didn't, because you did that. You do that bit, so we can do that in a minute. You can squeeze it in if you want.
I can do that in the next slide then after you've done this one. Is that right?
Yep, that's fine.
Fab.
So this is an image that I particularly like, hence why it's in our presentation. So it's a transition bridge, and it just shows us, and I think it depicts quite well how life sort of goes in transition. And you know, we start all singing, all dancing, and all happy one side, and then there's that whole preparation for leaving children's services, saying goodbye to people that have been there for 18, 19, 20 years. It's a bit chaotic, and it's going into that unknown, that whole new beginnings, and exploring what the adult world has to offer. The adult world is a great world. They really know what they're doing. So, you know, I'm really privileged to work with some very, very professional and knowledgeable adult colleagues. And some parents do say that it's changed their life going to adults. So we like to pioneer that it's all good.
I think that's absolutely key, isn't it? In terms of the we completely appreciate that when a young person has been with a consultant or and health professionals through paediatric services for so many years, that whole concept of moving forward and moving to the adult world is quite scary and daunting, not knowing who's going to be there. But we know from experience that, you know, we work with alongside our adult equivalents, and there's some really, really good people out there that replicate the support that is provided within paediatric teams. Our job is to help join up the dots and signpost to the health professionals and when they come on board. So yeah, before I talk about key publications, you probably introduce yourself as well, Angie, at the outset.
I did it a little bit ad hocly because I forgot to do it when we were talking about our names. So I've just introduced that where we both worked.
Yeah, so a little bit of background from myself as well. I'm a registered nurse for people who live with learning disabilities. I've worked in the NHS in various roles over the last 30 years. And now, as of the end of last year, I joined East Sussex Healthcare NHS Trust as the Young People's Transition Specialist. And you probably saw on that first slide as well that we're talking about different specialist pathways. So Angie supports young people with neurodisability, and I'm essentially everybody else. So the other pathways are things like diabetes, epilepsy, asthma, bladder and bowel, gastroenterology, audiology, cardiology, mental health, rheumatoid arthritis, and then there's an all-encompassing other conditions. So it could be oncology and other health episodes that young people get to experience. We're just really conscious as well that throughout transition, families are really anxious about things like supplies and equipment and how that transitions. So hopefully we provide a role in supporting that as well. Where will young people and young adults be going for appointments? What happens if the young person or young adult needs to stay in hospital? And obviously we've got Claire Slade here as well to talk to us a bit later on as well. And what support can families get if they need help with their appointments, and reasonable adjustments that we can look to have in place. So have a conversation about hospital passports shortly as well. So as you can see, key publications. I mean, there's a plethora of different publications, but we've put on screen here some of the key ones. So over the next couple of slides, just sort of guide you through. As you can see, we've got the stuff from the Care Quality Commission, NHS England, from NICE, from MENCAP, and the Together for Short Life Stepping Up guidance is also really good. So on to the next, if you go on to the next thing, Angie.
You have to say next, okay.
So yeah, there we go. So yeah, so From the Pond to the Sea was a key publication from the Care Quality Commission. It talks about children's transition to adult services. And as you can see here, key recommendations that there should be a key coordinator of health from the age of 14. It emphasised the importance of good working arrangements between different health and care services. And we've got health and social care representing this meeting here today, and highlights the importance of good communication and information about what to expect. And again, referencing to the health passports and a documented transition plan, including health history. Next, please. There's the commissioning guidelines as well. I'm not going to sort of read everything from the screen here, but I'm happy to share our slides afterwards for you to draw reference to. But you can see the sort of key points that came from the commissioning for transition to adult services for young people with special educational needs and disability publication from NHS England. And the next one.
Oh, man.
These are really key, the NICE quality standards. There's some key statements here. There's 5 statements. So statement 1, as you can read, statement 2 talks about transition planning and annual health meetings, and there needs to be a named worker to care and coordinate care and support before and after transfer. I think from our perspective, Angie, I'm supporting young people under different specialities, and where there is just one, but where somebody, for example, their health need is epilepsy, then I would be guiding and supporting the epilepsy nurse specialist around transition, where a young person has more than one health support need. So, for example, alongside epilepsy, they may have autism, ADHD, or come under a different speciality. Then I would be named, or Andrew might be named, as the key coordinator for transition. And there's another statement 5 as well coming up, and statement 6. Yeah, is there another one there? There we go. So NICE recommend that health and social care should be working together in an integrated way to ensure a smooth and gradual transition in adults, in young people. And there's a little bit more about the NICE guidance as well. It highlighted key areas of the young person's transition pathway that could have a big impact on practice and be challenging to implement, along with the reasons why change needs to happen in these areas. And adult services need to take that joint responsibility with children's services for transition joint planning, development and commissioning of services involved in transition across children and adults' health and social care, and that better communication and joint working between services to have that coordinated approach is so important. So yeah, another part of what Angie and I are doing is we are supporting young people's clinics, but there's also transition clinics within each of the specialities, so we'll be supporting those. And here we've got Stepping Up as well, which is the transition journey, and it identifies that it consists of 3 phases. And it's a generic framework towards preparation for adulthood, and but it emphasises the young person should be at the centre. The person is consulted throughout the planning process, and the young person chooses the setting and timing of meetings. Next slide, please.
It's me.
And it's you.
It's me. Okay, so within ESHT, obviously, we've really moved forward with transition in East Sussex, and the reason the plans that we have is to improve our knowledge and understanding and therefore the disease management of young people, improve attendance rates in our adult services, and ensure that there's engagement of service users, stakeholders and community. So that's what we'd like to do. By doing this, we intend to reduce attendances to A&E, reduce the inpatient length of stay, and to reduce those anxieties for our young people and their families, because we know that that is a key element. And to do this, we manage our expectation of our adult services and what we need them to do. So when we're moving from paediatrics to adults, we do need to tell them what they need to do, and just guide them, because it, you know, it is all new. We need to make sure that we're working together and that our services are age appropriate. Then the aim is that this will produce us a cohort of young people that are happy, healthy, and able to play an active active role within our communities and our wider society, within their limitations, and for their families as well, and to have streamlined support services from all staff that come in contact with young people aged 13 to 25. And there's a bit of national work going on around that. From the Burdett work that they've done, there is a national framework. It's not being called a framework, it's a teaching training programme that's just sat with NHS England, that's we're hoping to be rolled out hopefully later this year, so that all staff that come in contact with young people have this specific training around transition. So that's going to be amazing when that comes. So we've been working on pathways within East Sussex for transition. This is just a bit of an example of what we've done. I don't expect you to read what's on the left-hand side, because it is a little bit blurry. So we're trying to put pathways so that they're easy for professionals within our trust, and also for you as parents and for the young people to see what's going to happen at what times. We follow a standard Ready, Steady, Go traffic light system. I'll talk about Ready, Steady, Go again in a minute, because that's a tool that we use within Sussex and nationally, just so that everyone can see what the plans are. So if you were talking about bladder and bowel, for instance, what things are going to happen at what stages, so that you are aware, and also that everybody within the trust that is doing that job is aware of what needs to be done. So our goal is integrated working, to make sure that all of our services are communicating with each other. It's, you know, it's not rocket science, and that we have coordinated care that has our individual young people at the centre, and therefore making sure that there is as good as it can be, is optimal for the young people as they transition to adult services. We really need to be hearing the voice of our young people. I'm not sure where I'm stopping, but this looks like it's definitely me. So this is definitely me. So as the Roald Dahl knows. So just a quick chat about the charity that have funded my role. So Roald Dahl, Marvellous Children's Charity, have provided specialist nurses and supported seriously ill children for quite a number of years over the whole country. There are currently over 100 Roald Dahl nurses caring for over 32,000. I think that's probably a little bit low now across the UK. And basically what they do, the charity fundraise for posts, and then different NHS trusts, they bid for the posts, and they provide the, if they are successful in getting that post, the charity provide the funding for that role for 2 years. The commitment from the NHS trust involves another 3 years of funding. So in all, it's a 5-year post. But once those nurses and those posts are there, they will always be a Roald Dahl nurse, even though they are then paid by that NHS trust. That trust still gets to keep the status, and we all carry on being Roald Dahl nurses. And we provide support in other ways by helping to try and improve that resilience of families who we know find life really tough. We want to give families, young adults, children, as much support as possible. As nurses, we have access to excellent resources, bespoke training. If we get together and say, do you know what, we need to know about deputyship, or we'd like some training on mental health, or, you know, something that's happening, then the charity will go away and find that, and they will provide it for us. We work in hospitals across the UK. We stay with you until an adult. We are all quite well trained in and have expertise in the areas that we work in, and have that emotional support for you as a whole family. It says we're marvellous apparently. So I can't remember what's on the next slide, but we have other, I'm going to skip to it in case.
It's more Roald Dahl.
Oh, brilliant. So this is what I wanted to talk about. So that's fine. So it's, yeah, this is an old slide because it says 82 and 24, so the other one's up to. We have a plethora of nurses, and their specialities are ranging from epilepsy to undiagnosed syndromes and neuromuscular. rare diseases, sickle cell. So I don't think there are many nurses that exactly have the same job title as a Roald Dahl nurse, which makes it really useful and great because we can all talk to each other as well. So what do we do? How do we support our families? So you become a part of our caseload, and we provide clinical, emotional and practical care support. The charity give us training, which outcomes better patient care. They also have a family support service that includes financial support, which is really, really useful. And they've just started an emotional support service as well. And that means that at a tap of a button, by sending a text or by ringing, there's many ways we can get in touch with them. We can refer families, or you can self-refer to the family support service. They will help with appealing EHCP decisions, should that be required. We know that quite often is required. If you need help with applying for benefits, for PIP, for universal credit, or if there's an argument around transport, there's lots of things that they can absolutely help with. They have done amazing things with our families, and because the feedback has been so great, they've now started an emotional support service as well. So we just lost my train of thought there. The family support service is basically citizens advice, and they are a service that is actually now based and commissioned out from Cardiff in Wales, I think it is. So yeah, so that's where all our calls go. And we have nurse-led innovation. So if we've got any crazy ideas and things we want to do at the moment, we're looking at maybe doing something at the children's ward over at Hastings, and the charity will support us with that. So this just shows us, so if you've got any ideas of things you think would be great on the ward, let me know. This is just where we are. We're all over the place, scattered everywhere, which is great. This is my friend Bethan in the middle. She's on lots of our paperwork, which is fab. Still me, Lee? Yeah.
You can do this, or I'm happy to take over.
Yeah, you can go. You go then.
Yes. This just emphasises the Roald Dahl transition of care campaign, everyone's business, and it identified that need for that optimum visibility, and identifying that shared learning between professionals and understanding responsibilities. Transition doesn't sit within a specific service; it's actually everyone's business. And I showed you some of those sort of key publications earlier on, but I think it's just underlined in within those as well that it is about that joined approach. It is health, it is social care, it is children's teams, it's adult teams working together and having that coordinated approach, and raising the awareness to improve the quality of healthcare support for young people moving forward from children's to adult services. And there's the development of a neurodisability footprint within a Ready, Steady, Go and Hello programs. So that's a framework for transition, which we've adopted here within East Sussex Healthcare NHS Trust. So when we meet families for the first time and young people for the first time, we will be sharing with them the transition pathway from Ready, Steady, Go. So this is the publications, and it provides that information for young people and families. There's a QR code there which will work, hopefully, on your phones. It'll access to Ready, Steady, Go programme. There's a lot more QR codes actually at the end of this presentation which you might also find useful. But yeah, so within these publications, you will find some key questions. So Ready, Steady, Go is comprised of three key areas, three key stages, as you'd probably imagine. So Ready would be 13-14, Steady would be 15-16, and Go is 17-18, and Hello is when you've actually transitioned to adult teams. But within each of those stages, you will find key questions, key things that we need to that should happen, and it will provide prompts for families, and it will provide prompts for conversations, and involve key people in those discussions as well. So hopefully, I mean, I've been in post at the start of last year, Angie, for a little while longer, but I think the proof in the pudding will be families' feedback in a few years' time, where we've had that whole pathway journey of supporting people from the age of 13. They've come through to adult teams. What was that like, and how guided and how supported do you feel? It's important as well to recognise, I guess, the sort of key stakeholders that we've got amazing there as well. So just our well child nurse works within the East Sussex continuing care team, but we've got Sussex Partnership, which is the community learning disability team. We've got East Sussex County Council. We've got Paul here today. Angie would have mentioned the Burdett Trust for Nursing and the huge network that comes from that, and obviously NHS and other key stakeholders locally. Earlier on, I mentioned annual health checks. This is enshrined within that from the pond to the sea guidance from the Care Quality Commission as well. But essentially, since 2014, 2015, all the children and young people with a learning disability should be included on GP learning disability registers. And by virtue of that, young people aged 40 and over should be offered annual health checks. So one of the key questions that Angie and I will be asking when we meet people for the first time is, are you known to your GP? Are you invited in for our annual health checks? Is health action planning occurring? Essentially, the GP assumes the responsibility of key coordinator of the young person's care from the age of 18. So it's important that we're not doing that when somebody gets to 18 and paediatricians saying, now with adult services, it is that coordinated approach and making sure that the GP is aware of the young person and is inviting them in and getting to know them and their family as well at the earliest opportunity. And the annual health check, as it says there, and the health action plan is that ideal opportunity for the young person with complex needs and family to get to know their GP and for the GP to learn about their needs. And we're here to signpost and liaise with GP practices to where other health professionals are within the community as well. So an annual health check should look to capture what diagnosis an individual has, or the health professionals that are involved, therapies that are required, and their academic status, where they're at, if there's that education, health and care plan in place. We're interested about capturing whether a commission package of care is in place. That might be continuing care, it might be continuing health care, it may be social care, it may be a combination of all of those. And you can see here the nice quality standard for transition identifies that registered GP should be inviting people into the surgery, as we said, as part of health action planning. And as I mentioned earlier on, they are the lead coordinator from 18, so a key player. And the benefits of getting transition right, there's quite a lot to read there, but just putting up some key points that you can read when these presentations are shared with you later on. I think key, they're all key, but I mean, speciality inequalities need to be identified, monitored and supported to deliver patient-centred care. You'll see that obviously the young person always needs to be in the centre and learning as well from experience about how we can always strive to be better. Thanks, Angie.
All right, is this me?
Yeah.
So also in East Sussex and across the country, in East Sussex, we call it My Health and Care Record. So this is a way of young people or families, I mean, you can have your own as well. Any of us can have it. We can have our healthcare records on our mobile phone via an app. It links up to NHS, the NHS app that we were probably all very much on during the COVID times. And it basically is a record of your healthcare. So anything that happens to you or to your young person, they can have access to that when they are mobile and around. Very handy if you've got, I've got a family who quite often go to football matches up in North London. So if they end up getting admitted to hospital up there, actually they can share their record very quickly and get access to it. It is very new, and different health trusts across Sussex and across the county and the country are all adding things on this network at different stages. So we've just done some work around epilepsy transition, so that is part of our ESHT, My Health and Care Record, and then so Eastbourne, I think they have bloods on theirs or X-rays, and then Brighton have the opposite. So it depends where things go. At the moment, it's still in its infancy, but a very useful tool to have that links in with all of our care records. So keep an eye out for that. And that QR code just takes it should be mentioned on the bottom of all the clinic letters, as well as a young person gets to the age of 16, because you can't hold it until you're 16. But you can allocate people within there to manage it for you. Oh, healthcare passports. This sounds like it's probably a bit of both of us. So I'm sure you're probably aware of my care passport, or the This Is Me, and All About Me, sometimes it's called. So it's a traffic light system, and it's a passport about your young person and what their needs are. And things
these are just example pages. I think the important thing to recognise here, and if you Google care passport, you'll probably see sort of several dozen that will probably come up. This is the one that's being used predominantly within East Sussex, and this was ratified by our local Learn Disability Partnership Board. So these will sit on a young person's hospital records, and it basically captures what good support should look like and what things that are important to you. These are just example pages. The actual document itself is 16 pages, and those boxes will expand to capture as much information as possible. But the whole idea being that if this is available within the hospital setting, all health staff can access that and see that support and what it should look like, and the reasonable adjustments that need to be made for the young person. And the next slide should show a couple of alternative.
So we've got a health passport that we're just piloting in East Sussex. This is a bit of a more in-depth and a tweaked version of the last one. We're piloting it with our caseload of young people with cerebral palsy, just to get an idea of how it works. And it's just got a little bit more detail in it, but it's really useful, and it's proving to be very good. The biggest change, I think, for that one is the Mental Capacity Act being on the front page, just so that people are aware who is involved if the young person is over 18.
Fine. The other one is the autism, but the health passport that's been published by the National Autistic Society. From working with a few young people since I've been in post, we've identified with them that this is perhaps a little bit more suited for their own support needs, because it covers the autism aspect of what support should look like. Angie mentioned earlier on knowledge and skills, and the importance that everyone should have the skills to be able to support people when they come into hospital, into health settings, and the drive to promote skills in all staff who support people who experience a neurodisability or autism is not new. The Learn Disabilities Core Skills Education and Training Framework, as published by the Department of Health, was developed in collaboration with Skills for Health, Skills for Care and Health Education England. And it described what would be considered the core skills and knowledge, which should be transferable across different types of service provisions. And some of the areas for the framework include learning disability awareness, for example, communication in learning disabilities, care and support, person-centered care for people who live with a learning disability, well-being, independence, relationships, sexuality, sexual health, supporting children and young people into adulthood. I think the key thing is it's about those fundamental skills that would be mandatorily expected as by virtue of an individual's role in supporting young people who come into hospital and within care. And that you may have heard of the Oliver McGowan mandatory training on learning disability and autism as well, which identifies those range of skills. Oh, sorry, Angie.
Sorry, I skipped too soon. Yeah. Sorry.
I don't. So hopefully that's enough that I've just covered there. There'll be some more within the attached anyway. There's some more notes attached to that as to the sort of fundamental skills that would be reasonably expected.
And then another thing that we use in East Sussex Healthcare Trust is patient-led assessments of care. So they're known as place assessments. So this is where we get local people that come into our hospital and they look at the environment, and they look at our clinical environments and look at how that looks to the person that's walking through that door. You know, is there privacy and dignity? You know, what's the food like? Is the building clean? Is it okay? You know, is it generally maintained? You know, how is it if you've got a learning disability? How hard is that for you to move around the building? Is it are things well signposted? Are people friendly? So you know, those things are quite useful within our organisation. And another thing that we have that came out of this from NHS England was the 15 Steps Challenge. So this is to get a young person and children's perspective on what it's like to walk through that door, and to take, you know, from them, what do they see in those first 15 steps of coming into our services. If you've ever walked through the front door of Eastbourne DGH to go to the paediatric outpatients, you'll be well aware it's far further than 15 steps. So yeah, and the same with going to Kipling at the Conquest. So it's just having that perspective from the young people, which is really useful. This is what I've just said. And it just means that everybody, especially young people, we want them to have a say in what their health service looks like. It means that they feel safe, they feel cared for. You know, that's why we're there. We're there to be caring for our young people and for all our patients, and to make sure that we are organised and calm. So there's no right or wrong. We take everything that people say, so it's really useful. I've made my child do it, so it's quite good. This is something we developed last year around transition. So this should be up in all of our key paediatric areas and in A&E. So this is just a transition QR tree. It just gives us a little bit of, gives youngsters the ability to scan QR codes without having to get up and pick up a leaflet and somebody knows that they've picked up a leaflet about their mental health. Or, you know, so it's just knowing that those things are there. Youngsters are, you know, always on their phones, and QR codes are the way they communicate. So it's quite a useful.
We've had some really positive feedback as well, haven't we, about Young Minds and the support that they provide.
Really good, yeah. So Young Minds is a website for mental health support and relationships and everything, and it is just an amazing website for young people. The feedback we've had, it has been immense, and they segregate their website into if you're a parent carer, if you're a professional, and if you're a young person. So if you need support as a parent or a carer around a specific mental health issue or anxiety or, you know, anything, relationships, bullying, it's all on there. It is amazing. So I would encourage you, if you've got any of those issues, to have a stop there. And then, like, our Ready Steady Go stuff's there, and how to give us feedback. Ask me questions. I don't think we've got a slide on, but I'll just quickly tell you about it. It comes alongside the Ready Steady Go Hello Work toolkit, and it's just encouraging young people when they come to appointments to ask 3 questions and to just think about what 3 questions would I like to ask at that appointment, just so that they start to get used to asking questions, because in the future they may be going to those appointments. Some young people may go to them on their own, so it's good for them to have that ownership, really. And our young people with neurodisabilities, if they know in advance, then they may be able to communicate a way of being able to say what questions they may like to ask. Or as parent carers, we know you have more than 3 questions, which is fine too.
I think this is the last page, isn't it? Before we've got all just lots of links and resources towards the end for you all. So just a little bit about the East Sussex School Health Service, because again, they're not included in the key stakeholders earlier on, but I think we've added this one in as well. Their main hubs in Polegate, with hot desks across the county, and the aim of the service is to improve the health and wellbeing for children and young people through delivery of their Healthy Child programme, and that works through well, it starts from 5. Obviously, we start supporting people from the age of 13, but the school health service will continue to support people up until the age of 19. So again, if there's issues or some challenges within the school settings as well, key people that we can link in with. They don't necessarily have to be based within any one of our academic settings. They will just cover across the whole of the county. But yeah, so depending on which speciality they come under and which of the challenges are needing to be met, we can link in with professionals within this team to make sure that there's those reasonable adjustments within the school settings too. Their remit includes individual health improvement as well as the whole school health improvement. And there we go. There's some resources and web links there for you. And I think there's some more QR codes at the end as well.
There is lots. We do like our QR codes.
We do. Look how creative we've been.
Very colourful. So thank you. Hopefully you've got a bit more of an insight into transition, what that means for all of our young people and for our families, and that we all have a big part to play in this to make that a positive experience. And Lee and I are here at ESHT to help and support you, so feel free to contact us. That's why we're here. So thank you.
Absolutely. Thank you.
Thank you both. That was super helpful. I've noticed there's a question in the chat, and if you don't mind, we'll come to that at the end. I'm sure lots of people have lots of questions. So thank you, Angie. Thank you, Lee. That was wonderful. So moving on, if we go to Claire next. So Claire Slade is the Acute Learning Disability Liaison Nurse within East Sussex Healthcare NHS Trust. So if you're happy to share your screen, Claire, or were we sharing? No, you were sharing.
No, I'm going to have a go, aren't I? I might disappear. Watch this space.
Oh, thank you, Claire.
Right, okay. So let me know if you can see it. Can you see that?
Yes,
You can. Right.
we can.
There you go. That's the
Perfect.
whole thing. Brilliant. So hello everybody, I'm Claire. I am the Acute Learning Disability Liaison Nurse, and I am the liaison nurse within ESHT. I am a registered learning disability nurse, like Lee is, and I've got, like Lee, a number of years working in the NHS. My background is I've also worked in residential care for a number of years. I have the experience of working in residential services, and I've also had the experience of working in the all-age continuing healthcare team, and also recently I was the team leader for the Learning Disability and Autism health facilitation team. I am joined today actually by Emma Morris, who is one of the health facilitators from the Learning Disability and Autism health facilitation team. So she's going to be doing part of a presentation, just so that you get an idea of what that team does, because you might find that actually it might be beneficial to link in with them too. So moving on to the next note. So really, why is there that need for having an acute learning disability liaison nurse? Well, people with a learning disability can have really high health needs that at times can go unrecognised and untreated. And it's evidence that it can be really problematic for people with a learning disability to access a hospital setting, and support may be required to ensure that each individual patient's needs are met effectively. So does ESHT or East Sussex Healthcare NHS Trust have an acute learning disability liaison nurse? Yeah, they do, and that's me. And they have had one for a number of years. Previously, at the very start, it was a lady called Jean Duffy, who is now a nurse consultant in Sussex Partnership Foundation Trust. And after that, it was a lady called Erica Pope, who's now moved on, and she's actually a special needs health visitor within East Sussex. I've worked as one of the acute learning disability liaison nurse part-time right up until February this year, and now I'm in the full-time post. And I cover the Eastbourne District General Hospital and the Conquest Hospital, so I have quite a big area I'm covering. And I help support people with a learning disability and their families and their carers when accessing the hospital for any reason. So it's not just because they're coming in for an appointment, it can be a multitude of other reasons why I'm being involved. So the acute learning disability liaison nurse in ESH, what do I do? So I aim to play an important role in raising the profile and the status of people with a learning disability who attend the Eastbourne District General Hospital and the Conquest Hospital. And I actively promote the rights and the needs of people with a learning disability, including any specific support needs that they have, any issues they have around consent, and having that right to have treatment. And I work directly with patients and their families and their carers to assist them with any admissions to the hospital. And I will liaise with any of the specialist teams and hospital staff to identify the support that that person requires. So whether that's at clinic or whether it's a pre-operative visit, coordinating inpatient stays, and any of the discharge planning if there's somebody that's actually in hospital at this time. And I support people to ensure, sorry, my part of my screen's missing. So I support and enable hospital services to make reasonable adjustments with their care delivery for people with a learning disability as well, because quite often we still find that people do not understand what reasonable adjustments are, and actually they legally have to ensure that people have a reasonable adjustment in place. I raise awareness of the specific health issues that people with a learning disability have, because that seems to get missed quite a lot. And the other important thing is that Lee and Angie have reflected on is about the educational piece. So I provide education and training for all hospital staff to increase their awareness of the needs of people who have a learning disability and how to adapt and plan care for them. So I've done training for healthcare assistants in the hospital, newly qualified nurses, overseas nurses, and I've even been invited, which was quite daunting, to what we call the grand round, which is where all the doctors in the hospital have access to about an hour's webinar where we talk about specific issues or pieces, and I was invited to do that for people with a learning disability. I work with the learning disability multidisciplinary team in the hospital. So a lot of people aren't aware that actually in the Conquest and also at Eastbourne District General, we have a learning disability multidisciplinary team. And we help to organise complex submissions for people with a learning disability for investigations and procedures. Most of the referrals for the learning disability multidisciplinary team come through me, and I quite often identify people to those teams. They're led by consultant anaesthetists in the hospital, and sometimes, well, one in particular, consultant anaesthetist, is very well known for the work that he's done in supporting people with a learning disability into hospital. Unfortunately, he's decided he wants to retire, but he has handed that post over to somebody who's equally as good. So again, if and I know that Lee is doing this currently, if we have somebody that is in transition that is requiring a complex admission to hospital for an investigation or procedure, they can tap into the learning disability MDT. I also work very closely with colleagues in primary care, and that's to help patients who are coming in for planned appointments and procedures. So that might be preparing for their hospital stay, helping them to make the experience less stressful. So that might be coming to do some initial visits before actually coming in to look at the equipment, being able to touch certain pieces of equipment, and making it as a positive experience as possible for them. So what can I do as the acute learning disability liaison? What can I help with? So as I've said, I can help with pre-admissions, admissions and discharge planning for people. I can help arrange what we call best interest meetings for people. I can place a learning disability alert on a patient's records. So the records that generally are used in this hospital is a system called eSearcher, and I can place a specific alert on that system. And I can also ask for that alert to be shared within the emergency department systems. And that gives a very brief piece of information to anybody that looks at that alert, and everybody is required to look at an alert if it's placed on a system, which tells you certain things that you need to know about the person. It's really a snapshot. We then would direct people to then be looking at the person's hospital passport as well. As Lee said, I mentioned hospital passport. So I help support the development of hospital passports for people. And again, one of the biggest things I do is aid communication. Communication is such a wonderful thing if it actually happens. And quite often there can be missed opportunities for really good communication. And sometimes I'm the middle person that interacts between a person or their family or their carer and the actual clinician. So that's a really important part of my role. As I said, I offer educational opportunities and advice for people with learning disabilities and their families and carers. So I'm happy to, if they need a specific piece of information or some time to go through something that's going to be happening for them, I'm able to dedicate that time to do that for that person. I offer carer support and advice, including any signposting. So I might get contact from a carer in regards to somebody that actually doesn't meet my criteria for accessing the service that I offer, but I'm more than happy where I can to signpost people. And quite often what I do is, even if they don't meet my criteria, I will do whatever I can to support a person. I provide information on what to expect and what will happen during any treatment or procedure, and to aid the understanding and enable informed consent. Again, that's a really big topic, is ensuring people have informed consent, and where consent, a person doesn't have the the ability and doesn't have the capacity to consent to a procedure, then ensuring that things like best interest meetings are had and the correct consent forms are completed. Quite often you'll find me in outpatients. I do support a lot of outpatients appointments because quite often what's happened previously is those appointments haven't gone well because, again, the person's not been listened to, or their family and their carer haven't been listened to. So I quite often ask for another appointment, and then I will go along to that appointment too. I can provide accessible and easy read information. So I quite often will try and find that easy read information first, but if I can't, I've got access to a system called photo symbols, and I can develop that information specifically for that person. I can offer advice and support around those reasonable adjustments that can be made to accommodate an individual's needs. And I liaise with GPs, community health, social care teams, and other relevant professionals in regards to ensuring somebody has really good support in the hospital environment. So this is my contact details. I've got a generic email address that I use. So if you wanted to contact me, you could use that email address. Equally, that is my work mobile number. So I always say I don't get a very good signal in the hospital environment. So if you do contact me, please do leave a message and I'll come back to you as soon as I pick up the message. And just to make you aware, because I'm not sure whether you are, it's Learning Disability Week this week. So if you can and you want to, MenCap have got some amazing pieces on their website. So please go and have a look at that. So I'm going to stop sharing my screen now.
Lovely, thank you, Claire.
It's done.
You've done.
And I've done, and I survived.
Amazing, thank you. So yeah, just noticing there's more questions coming up in the chat box, but we'll address those afterwards if that's okay.
Absolutely.
Okay, so wonderful, thank you. So if we could move on to Emma. So Emma Morris is, as Claire just said, the health facilitator from the Learning Disability and Autism Health Facilitation Team. So are you happy to? Yes, you're sharing straight away. Wonderful. Thanks, Emma.
I've got this far. Oh goodness, now I've got a box in the way that I can't go to present. Talk amongst yourself just for a second. It all worked perfectly earlier, didn't it? And now I've got a box.
Are you able to see slideshow?
No, because I've got a big black box over that.
I think if you hold your mouse down at the top of the box, you can move the box around your screen.
Oh, fabulous. Thank you.
Oh, well done.
Slideshow.
Brilliant.
How's that? Is that
good?
Great. Okay. Yes. So, hi, my name's Emma and I'm from the East Sussex Learning Disability and Autism Health Liaison and Facilitation Team. That is a mouthful. And we are a team that have been employed to bring specialist knowledge and skills and expertise to support people with a learning disability and autism to access healthcare. So we can offer a variety of support, and this isn't an exclusive list, but we offer support around annual health checks, easy read information, reasonable adjustment, training. We link in with Claire quite closely, the acute liaison. We can work alongside desensitisation programmes with people. We can offer advice and support and generally signpost to the right services.
Sorry, Emma, sorry to interrupt. It's not in slideshow format.
Oh, is it not?
No.
Oh.
You want to try again?
Slideshow.
Just to make it larger so that everyone can see.
How's that?
That's it, perfect. Thank you, Emma.
Great. Okay, I've jumped ahead of it now, so. And that would have entirely have thrown my flow. So bear with me while I get back to where we were. Yes, and signposting people to services. So we work with individuals from 14 and above, age 14 and above. And we work primarily with GP surgeries who hold a learning disability register. And those registers, we work with them to increase their registers, because although we know that there are approximately 12,000 people with a learning disability, there are currently only about 3,500 people within their registers. So everybody with a learning disability should be on the GP practice register, but not everybody knows about it. So we promote those registers and ask the questions, who's on the registers. We also go into GP surgeries to help them validate their registers. And we may add people to those registers or suggest people be removed and put onto the appropriate register. And being part of that register, as Lee and Claire spoke about earlier, means that you would get an annual health check from the age of 14 and above. Every person with a learning disability on the register should be getting those annual health checks, and we work with surgeries to not only increase the uptake but to improve the quality. And so part of our team's role has been going in to offer training and support to surgeries across the county. We also create our own links. So there are 3 members within our team covering East Sussex, and we each cover our own PCN areas. We all have our own areas, which means we get to know people within the surgeries and the key people that are supporting our people with learning disability and autism. We know that the life expectancy of people with learning disabilities is shorter than that of those of the general public, and we know that there are deaths that occur that are avoidable for people with learning disabilities. Currently 49% of those of learning disability deaths were classed as avoidable in the last year, and that compares with 22% of the general population. And I know that sounds quite a grim number, but what that does is that gives us the opportunity to look at what those barriers were for people to get that healthcare that they needed and what was happening, and we're then able to undertake either local projects or be part of wider national projects to challenge what has caused those deaths and to educate. So some of the barriers that we know coming out of our themes are diagnostic overshadowing, a lack of knowledge for the person with a learning disability, so we can support to educate those individuals, a lack of health promotion and accessible health information, so that's the easy read information, so we're able to help support people with that. Individuals with communication difficulties, a lack of awareness amongst mainstream health professionals. So we also look at the alerts that your GP surgeries might hold for somebody, and we look at how meaningful those are and what we can do to improve that, because for some people, if they read an alert that the person's got a learning difficulty, it doesn't actually tell them what the person's need is to support them to come into the surgery and to access their health care. We know that time constraints can be an issue, physical access is really hard, and there's a lower uptake of national screening programmes. That's actually a project that we're very much involved with at the moment, and that I'm personally quite excited about. So we're able to get involved in a lot of areas and support with a lot of those areas. But what I'm not able to do now is move my slides on. Yes, I can't move my slides. So if anybody with any technical ability is able to offer a suggestion.
So it's not moving at all.
I don't actually know if anybody's still there.
Oh, can you hear me, Emma?
Oh, I may have spent the last 5 minutes talking to myself.
No, we can hear you, but I don't think you can hear us. Can you hear us? I think we've got an audio issue.
Hello, could somebody say if they're able to hear me?
Okay,
or...
I'm going to put something in the chat.
Okay.
Can you hear her, Emma? Marie?
Yes, yep, I can hear
Great.
Emma, but I don't think she
But I
can hear
don't
us.
think she can hear us.
Mhm.
I don't know if anybody's able to hear me, but I am really just stuck with a blank screen. So I think
Okay,
if you can
I've
hear me,
sent
I'm
her
going
a
to
message in the
try
chat.
and come off of this. And oh, okay, you can hear me. That's great. I can't hear anybody and I can't move my slides on. Ah, hang on. Yes, I can. We're back.
Brilliant.
Oh, goodness.
Okay.
Sorry. I'm sorry about that,
Right.
everybody. That was, I don't know what happened there. So I'm not sure how far we got and how much people heard, but what we're doing is, in a nutshell, is we are supporting the individual with a learning disability, their carers, local providers and GP practices to overcome the barriers to accessing health care services, because we know that access to good quality health care and an annual health check with a robust health action plan can save lives. That is my last slide.